we need a comprehensive medical team to take care of these patients, whether it's Dr. Melnick's expertise with internal medicine and in these situations, whether it's kind of a social environment, we need case managers, caretakers, social workers to help with these patients, whether it's kind of cognitive, depression, any other kind of post-traumatic stress that these patients are going through. Having neuropsychology part of the team is instrumental. And our role and my role is I'm a physiatrist, a physical med and rehabilitation physician. So what we do is see patients we were seeing these patients on the front lines, maybe these more severe cases where they were admitted to the hospital, intubated, prolonged ICU course, and eventually these patients get a little better, but they're not quite ready to go home. And so they come to the rehab floor, and we have this comprehensive kind of care plan at the rehab floor. And Dr. Morris, our chair of the department, was starting to notice that these patients would get better. Hopefully, for the most part, we get them stronger and get them better and get them home. But then we'd also have outpatient follow-ups with these patients. And then not only was it the severe patients that we saw at the rehab center, but we would get these, and now we do this mild, moderate, severe kind of labeling with these patients. But a lot of these mild, quote unquote, patients still have these lingering kind of long-term problems that, the post-COVID clinic was created. And so what the post-COVID clinic is basically, like Melissa was saying, you're getting kind of a team approach for your care. You're not alone. We have a team that's going to help support you, whether it's a medical condition, whether kind of like I just said about depression or anxiety or fatigue or social issues. You're going to get almost an inpatient rehab experience, but on an outpatient basis, if that makes sense. So we will try to send you to like a pulmonary rehab program if you need it, if poor endurance, poor conditioning. We send you occupational therapy to work on cognitive tasks and that cognitive fog. We send you to speech and language if there's issue with swallowing or just memory. We send you for neuropsychology evaluation. We send you to psychology for post-traumatic stress, cognitive behavioral therapy. Any resource that you kind of need to function at home like you used to, we try to figure out a way to provide it to you.